MyCare is an application on a mobile phone or on a browser which allows people to access their own information about their care. The information that is available will include the dates of admission and discharge, of outpatient attendances, procedure attendances, but also letters about those things and results. Normal results from secondary care will be released immediately and be available in the app. Abnormal results won't be available immediately, but will be released after 2 weeks. That's so that a clinician has time to interpret those results, action them, but also communicate them in a meaningful way to the individual for which they're about. Some results are on manual release only and will only be released whenever the clinician decides to do that, perhaps to allow more complex actions. That means that some results are never released because what takes the place is a clinical letter or communication directly from the clinician. A competent adult can decide to share aspects of their record with another person. This is called proxy access, and you can do that on your own. However, access to healthcare records is also important, if not even more important, for those that don't have the ability to decide who can access the records or not. And an easy example to understand is where a child is the patient and the parent. It's in the child's best interest that a parent is able to access the records and the clinical information to help guide things. Another group of people for whom it's obvious that it's in the best interest that others can access the record are vulnerable adults, perhaps people who have dementia or other conditions which mean that they don't have the capacity to decide if someone else can access their records, even though it is clearly in their best interests. This could be to help guide their care, to make sure that they get to appointments and help explain information to them. And this proxy access is really important. The app is easy to download. Whenever you go to the App Store on an Apple device or the Google Play on an Android device, you choose the MyChart Epic application. This is important. That's the name of the app from the company that provides it. It will take you through identity verification steps, and that will be for Northern Ireland residents through the NI Direct app. For people from other jurisdictions like the Republic of Ireland, you can have your identity verified, but it's through a manual step that will take a little bit longer. Whenever you've done that, it will display as MyCare, and that's the name of the system as it's operated within Northern Ireland.